Hey everyone, today I'm going to teach you about GBS. This is a bacteria that is very common in adults, not an infection, but it is something you are tested for between 35 and 37 weeks. You need to know about this because you need to know what happens if you are positive. And we don't want babies to get GBS is because their immune systems aren't strong enough. They get very sick if they come in contact with GBS, and that is why you're given antibiotics in labor. Things like pneumonia or meningitis may happen if the baby comes in contact with GBS. And so if you are positive for GBS, antibiotics are given when your water breaks or when you start labor, whichever comes first. This lowers the baby's risk of infection by about 80 to 90%. Now, I want to make you aware of a few things. Having antibiotics in labor does mean your labor is on more of a time clock. You have to go in right away when your water breaks. You are hooked up to an IV, which means your movement is more limited. Although it happens every 4 hours and you will get a break, it's still something to consider. You are given the IV of antibiotics until birth. Providers aim for 2 doses before the baby is born. GBS is very common and it goes in and out of the system. This is why being tested as late in your pregnancy as you can is the most effective answer. Things you can do to combat GBS, they're not proven 100%, but things like probiotics, fermented food, which leads to good gut health. Getting antibiotics in labor for GBS is very common, but what I want you to be aware of is what comes with it. Hooked up to an IV, going in early when your water breaks, having an intervention, especially if you're going for an unmedicated birth. These kind of small interventions can cause distraction, and so you want to prepare for them ahead of time. Have a plan with your doula or your partner to distract you from that moment and keep you in labor land. I urge you to read evidencebasedbirth.com about GBS. It is your choice to get antibiotics or not, and you need to know it is always your choice. Do what you feel is best for you and your family. I have a simple guide I can send to your DMs if you want to keep it on your phone just to have as a backup and to be able to talk to your doctor more about this. Thanks for watching.